Looking for ways to help improve your SI joint pain or even increasing hip and pelvic rotation? We have just the thing coming right up. This hip rolls exercise for back pain is mainly an awareness exercise. By bringing awareness to the area, you'll notice more stability in the SI joint and a less compressed feeling in the lower back. So let's get into this exercise. All right, so we're moving on. We've got a lot of great exercises. If you haven't done some of the previous Feldenkrais-based exercises, I invite you to check out those videos. We'll link those in the descriptions box below. But the main point of this setup now is hip rolls. Now, what we want is we want to get our hip remaining flat. I'm gonna use my arms, and this is not easy for me, so I'm not the best that can definitely do this, but a lot of dancers, a lot of people who have a lot of rotation here are able to do it very efficiently. So your goal is to keep rotating it in, and you don't want the hip to go up. So our goal is even just, I like to rest my hands here. And so we're trying to train these little muscles to keep our hip, the ball inside the socket. So I'm just gonna pick my right leg right now. And the goal is, whatever you do with your leg, your foot, sorry, I don't care. It's just kind of straight, and then we're just moving in. Now you're gonna keep moving it in, and the goal is actually in more than out. I don't care about the out. I really care about the in. So you wanna move it in until basically the quad muscle starts engaging. When the quad muscles engage, it pulls up. So our goal is to pack it back. We're trying to, I like to even just say a layperson, we're trying to pack our hip back. So we're gonna go right through there and back, right through there and back. Now what's gonna happen is I actually think we're trying to slowly seat, or like I said, pack that hip back. That ball and socket has some sort of like, I don't know, like a little protrusion if you kind of look at the anatomy, but there's like a little like knuckle worth of something. We're just trying to slowly pack it back in, and over time it's gonna find its way to be more stable and kind of live there instead of out here. So we want that hip to be back and in. So we're just slowly packing it in, slowly packing it in. Now the cool thing is, as we're doing this, you're also feeling it here in that pelvis, and you're releasing the tension in your back. So I like to put pressure here to just remind myself and encourage that hip to turn in. And right now it's slowly kind of, like I said, getting to that knuckle part, trying to drop in. And then as I do this, it's starting to roll more. And so I can feel these muscles engaged and these muscles disengaged, and just something deep here working. So now if you get good at this, you can do both at the same time, but you can kind of see how this now moves a lot better than the left. So you should do both sides. Ideally you're doing both sides, but so you're just packing it back, and I'm just kind of keeping my hands here, slowly turning it in, turning it back to like neutral, turning it in. Now, this is also similar to a hip rolls exercise we've done. It helps your pelvic floor. So it's just being a little bit more intentional with this one, with the target being more your hip control and your SI joint being looser and having the range for that great pelvic rotation. So we're keeping it back and down. So I'm just doing that. Like I said, if you get really good at it, you can slowly work at the same time. You don't want these guys to shoot up, or you don't want your back to arch. So great. And then you keep doing it. Take 2, 3, 4, 5 minutes. Just keep doing until you feel like comfortable. And then when you stand up, hopefully you feel like it's more back and in a more set position, which is gonna be golden for all you guys for those critical movements for rotation, golf, baseball, whatever you guys wanna do. So yeah, that's it. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter, not harder.